All right, thank you, everyone. Most of you have met me, but my name is Greg Merrill. I'm the clinical social worker in the outpatient palliative care clinic. It's really nice to be with all of you today, kind of listening and learning. We're going to end, I think, in the most appropriate way, going back to what inspires us all, which is our patients, their lives, their voices, their families, and what matters to them. And so when Dr. Higginson was talking earlier about all the data, and really at the end of the day, what matters are the people that we're serving and how we're able to help them, and if we're able to help them, and also how we can do a better job in the future. Was very privileged to meet the family before me, before you, in March of 2023, so a little over a year ago. Mr. Michael Montez and his wife, Sandra, and they have 2 children that have been very involved in their care who are probably online. So saying hello to Stephanie and Matthew as well. And I really just want to turn it over to Michael to share with you his journey, what he's learned along the way, and what he might impart to you. Thank you so much for being willing to be with us today.
Honored to be here, glad to participate. I should use this. Yeah, it's been an honor to be a participant here and talk about my journey and my wife's journey, and of course my son and daughter. My lung disease was diagnosed in October 24th of 2022 with Dr. Nala Matthew. He works out of Calistoga, and so we went and I was referred to him because they didn't have a pulmonologist in Santa Rosa where we live. So we went there and really pleasant doctor, very smart doctor, very conscientious, and so to be very brief with that, he worked in a building that was a converted home, 2-story, and so he was analyzing me because he's a pulmonologist. So he said, why don't you walk for me? And I said, no, I'll thinking me as a young man, I said, I'll go up those stairs. So I walked up the stairs, and I just thought I was going to lose complete ability to breathe. And I came down the stairs, and he said, you're going to the hospital. Pulled up an ambulance and took me there. And so we continued that medical relationship. And he said, well, I think we should have a lung transplant, and you should either work through UC Davis or UCSF. And so my medical plan said it was UCSF because that's where they said I needed to go, and they would cover my medications and stuff and services and everything. So that was the start, and he was just, I call him Dr. Ravi, that's his short for his first name. And anyway, he still sees me, we still communicate. He saw me after my lung transplants, and so that was just a wonderful journey to be a part of, and he continues to interact with me. So the decision to pursue that lung transplant wasn't April 23rd, April 2023, and so I pursued that with UCSF, brought that up, and so we went forward with it. I did have a challenge with COVID, and so because I had COVID, I had pulmonary hypertension as a result of it, and so there was a mandatory requirement to have double lung transplant. And the best part of my journey, in my estimate, aside from the medical plan, that the medical doctors, nurse practitioners, you name it, everyone here in the medical staff were phenomenal. But I came across a social worker named Greg Merrill, and we became involved a lot with respect to him guiding me and giving me assistance, and he provided that same benefit to my entire family, and so it was great that my wife and my son and my daughter could have opportunities to talk with Greg and others on staff as needed for palliative care. And I think palliative care is misunderstood by a lot of people, and I think there are a lot of people that go to like Stanford and they'll pursue lung transplant, and then they happen to get to the age of 73 and they say, well, sorry, you're 73, we don't do lung transplants after 73. And for the most part, they do one lung, they don't do double lung transplants, as I understand it. I don't know for a fact because I never went there, but then they come over and they might come in contact with me, and I say, oh, you need to talk to palliative care. You need to get that assistance and help. And they have no clue what that means. And so I just want to say that I've had the benefit of having Greg, and then I had Dr. Lindenfeld, who's online, and he was phenomenal, great with well, I'll get to Sarah. So
this is how visits went with this family too.
This is how we are. That's just we hate to say it, but we've been married since we were 18. So, yeah, 52 years. So, you could do the math on how old we are. But anyway, Dr. Lindenfeld, he gave me medications that would help either my sinus drainage or if I had trouble sleeping, and he gave me stuff that was very comforting and not overwhelming. And to this day, I take when I need to. Like last night, I wanted to get a really good sleep, so I took one of my medications, and it was great. Wide awake this morning, and afternoon. But anyway, Dr. Lindenfeld was phenomenal, and we had a number of dialogues with him, but the one that resonates me the most is the last discussion I had with him before I went in for surgery, and I think one of his inputs was beneficial for me getting a lung transplant, because we met, my wife and I together, and my son and daughter online. So we did a Zoom for all of us, and he asked questions about, are you ready, so on and so forth. And I think, the real comment that he brought up was, you could leave this world on the operating table, and and I won't go into all those details, but I said, well, if that happens, just pull the plug. And then my son spoke up and said, well, Dad, the three of us will make that decision, Mom and daughter and him. And I said, okay, great, that's fine. And but I was open and accepting, and I think the palliative care was very, very, very significant to making that kind of a decision and feeling at peace at it, and going forward. And then just before that call, I talked with Sarah Ballos Meister, and she was spot on. We talked. I'm Catholic, Christian, and we had that dialogue about religion and so on and so forth. So the combination of Greg and Dr. Lindenfeld and Sarah were spot on for me and my family. And so I guess to go down further down this path was when I got rolled into the operating room. Never before in my whole life was I so calm, so at peace, so ready, so blank in my mind. There was nothing on my mind whatsoever. And the only thing I remember is looking up at the operating lights and just hearing the surgeon or the anesthesiologist says, well, I'm going to give you some medication now, and that was it. Lights were out. But the funniest thing was Dr. Kakesha was my surgeon, which she is just sent by an angel, just phenomenal. And my wife always says, what did you say she said?
Oh, we mean before she took you
You
in?
need a microphone.
Oh, here I am. Oh.
Yeah, right before she took me in.
I just
What'd you say?
wanted, yeah, I'll just real quickly, I don't want to rain on your parade here. But Michael, when he got listed, it was 23 days when he got the call. I didn't know, I just wanted to share that with you. And Dr. Caucasia, when she came in, because she wanted to disclose some things from the beautiful donor, the angel, unknown angel,
Little
which she did. And so then, so she looked at him and I said, so is this a go? And she says, this is a go. So she grabbed Michael's foot and said, we have a date, but you're going to be asleep and I'll be awake. It's what he doesn't remember that, but I do.
No, I don't remember that at all.
So to lighten things up a little bit, before they wheeled him away, my daughter and I were with Michael, and I said, I got a little jealous. I said, but that's okay, because you're going to be asleep. You just have to, make the best of it, is what we did. But anyway, sorry, go ahead.
That's right. So anyway, I just couldn't say enough about the palliative care that I received. And to this day, I still remember one of the original comments that Greg said, and that was when I was early diagnosed. He said, you have to get out of bed and do stuff. You can't just stay in bed all day long. You need to get up. And so, it was a motivation to get up and walk, get up on a treadmill that I had. And to this day, I just remember that. And I even teased him the other day when we were talking. I said something similar. And anyway, I also want to mention that people that go through a lung transplant need to have a support team, support network. And in this case, my immediate family, my wife, son, and daughter, they went through similar discussions for palliative care, and it was beneficial for them, very much so. And I will also say that I had a great family, because I also have a son-in-law that's married to my daughter, who's great, and my sister and brother-in-law, Kathy, and actually I have a doctor in the family. I have him and his son, but Dr. Jim Bonnefeld is a radiologist, but he was always there to talk about things, always wanted to get copies of my charts and look at scans, and he was just so very, very helpful. And then there's a close friend of ours that we've known. She's known since she was 13, and they're still best of friends. And she flew in to take care of family and allow Stephanie to come and work with us and support us while we are here in San Francisco. And they're just other family members that always were good and caring and actually praying for me, and all those prayers, I think, really helped and really benefited me. So I've kind of talked about the surgery and being so peace and so on and so forth, but UCSF as a complete package is just probably number one in the nation. And I kind of heard that rating, not from someone I know, but it was brought up, I think, in one of my Zoom meetings. And so I'm just so excited to be here and contribute, and I am willing to donate of my time to help those people that go through the process of either having a transplant or not having a transplant. But it's just a privilege because I got the benefit, and as long as I'm still kicking it, I'll keep providing services. So I think I'm done.
Thank you. On Dr. Higginson's slide this morning, what started us off, there were some patient quotes. And most of you know I chart very qualitatively, and I take quotes, and they sort of like tell me where someone's at in their understanding and their acceptance of their illness. And I'm going to read back to you just a few things you said. All right? So when I first met you, which was March 2023, you said, "I'm on a roller coaster that just won't stop. I'm all over the place." And yeah, and Sandra, you said, Sandra said, "I don't know what to do for him." Right? And then I want to read forward, because in June of 2023, just a few months later, you said, "It's a new life. It's a new way. I'm learning to work with life challenges." Right? And then moving forward to January, you said what you just said, which is, "I've never felt so at peace in my life." And just that, what you did to get from where you were to where you are now, both individually and as a family, was just incredible to witness. And Sandra, your family just grew so much. We've talked about this. We'd love for you when you feel you're ready. So talk about how your family grew through this experience.
Yes, and I wasn't going to do this, but you made me cry.
Sorry. I tend to do that.
I had it together till that. Because I do
Almost
remember
made
those
me
days.
cry.
They were tough days. You know, Greg had a few questions for me that I wanted to think about and share with you, like what the stresses were, you said, that we went through. There was a lot. The unknown, the worry, insurance, phone calls. Oh, sorry. Phone calls that my daughter and I made over and over again to get him an appointment as soon as possible, because we knew time was of the essence for Michael. And our lives just changed in an instant. Sorry. Yes. So navigating, like I said, the insurance and the phone calls and appointments, and it was overwhelming, and it took about 8 months, I think, for Michael to go through the process of seeing if he could be a candidate for a lung transplant, a double lung transplant. Scared the living daylights out of me. When Dr. Lamonthew said that to us, the pulmonologist Michael referred to in Calistoga, because he knew Michael needed it, and so he said, "Start it now." And good thing we did, because it took, like I said, about 8 months to go through, because your lungs have to be bad enough to be a candidate, but the rest of your body has to be in great shape, because you're going to be given a beautiful gift of lungs. So we started the process. And also, Greg said, "So how did your family change?" Well, we were so blessed, Michael and I, to have Matthew, Stephanie, and Dan, our wonderful son-in-law, and our 2 grandchildren. They're young. They don't really know. They just know Papa got new lungs. He got fixed, and that you need a support system. You do. And I could see why it's so critical when they interview you, or, you're talking to different doctors and whatnot, and social workers. you have to have a support system, and I could see where it's a deal breaker if you don't, because you can't go through it alone. You just can't. And just the ICU, that alone, and I think I talked to Greg when Michael had just been discharged, and it was a very difficult time. And I'll never forget when he said, look, you're in the thick of it right now, but you're going to get through it. You're going to get to the other side. And we have. You know, you just have to hang in there, you know. And
So I just wanted to chime in and say, as a palliative care giving person, or giving palliative care person, I think it's important to inform the future possible recipient if they have a transplant, and the support group, or at least tell the significant other that they need a support group. And so something I just came to mind with her comment is, many times, well, and specifically, there's one recipient who just left the hospital yesterday, and I met him when we were getting approved by Dr. Tran for the lung transplant, and they I think they came from Stanford, right?
yes,
Yeah, because
he's 73.
he's 73 now, and but they had no understanding of the palliative care that I went through, the benefit I had. So I guess the only thing I wanted to chime in and say is, sometimes as part of the palliative care, it's probably a good idea to talk to the patient and the recipient, as well as significant other or family members that are available for them, to let them know that they need to be a party to caring for the person who needs the help. So anyway, just a recommendation.
I think on that note, I also wanted to share that it's so important that the patient and the spouse and family are aware of all the help that's out there, the resources, the support groups, Zoom groups. I sat with Michael almost at every one. I did. I was by his side because I wanted to learn. And at that point, you're so hungry to get as much information that you can. And that's why we want to give back. And I really feel that's why Michael's been given this second chance, because we want to share and help everybody. We have met so many people that just said, oh, yeah, those Montezes. Yeah, those Montezes. And we always come in a group, right, Greg? They're always, not just the two of us. Matthew,
All
Stephanie,
four.
yeah, and then Dan when he can't, yeah. Yeah, so I just can't say enough about the Zoom, the groups, Alita. I mean, she's been wonderful. Ann Johnson. I mean, there's so many. I can't even name all the names. Just there for you and really care. You know, it really helped me. It helped our family. Yeah. I think.
I just want to say too, Sandra, I saw so much growth in you and in your children. And, you know, when you have a serious illness in your family, everybody's life changes. The way you interact changes, your roles change. It's very disruptive. And I saw your family grow through this, each and every one of you, and grow in like the most respectful way to one another, giving each other grace and space. Yeah. Having irritable moments, that's part of illness and caregiving too. Staying deeply committed to each other to get to the other side. And just your family was just a remarkable family to work with, is a remarkable family, will always be a remarkable family. And that's certainly what I'll remember the most about the time we've spent together is that.
Well, you're pretty remarkable yourself. Great.
I would love to open it up if there are questions for either Sandra or Michael from our online audience or from anyone here. We have about 10 minutes.
Michael, Sandra, I want to say thank you so much for being here and for sharing your story with us. It's really, this is why we do our work, and it's so great to hear from you about it. So my question is, what you would say, Michael, to people who are still hoping to get a lung transplant. I'll be honest with you, I think a lot of the people that we see and who are sent to us are people who are either unable to get a lung transplant for whatever reason, but the people who are waiting for a lung transplant are felt like, well, maybe they're not right for palliative care because they're going to get a lung transplant and they're, hopefully they're going to be, okay afterwards. And what would you say maybe to patients, and what would you say to the, to the pulmonologists about the value of palliative care in that setting?
Well, my perspective is I could not have gone through all of the medical tests that I went through. I mean, they've been into my heart like, I don't know, at least 3 times. And they wanted to make sure that my heart was okay and other aspects of my body were prepared. But I couldn't have done all the medical requirements to get over the trip line, so to speak, for surgery without palliative care. And what would I say to them about palliative care? It is, from my viewpoint, it is a requirement because I saw the benefit, I felt the benefit, and I just can't tell you how ready I was for surgery. And yeah, you go through all those medical tests, and you have all the great nurses, nurse practitioners, and I had what I would say are the best, but they're probably just as fantastic as other members of the staff. But palliative care is, in my viewpoint, mandatory because it gets your mind right, it gets you prepared, gets your family prepared, and allows us to share with other friends of mine. I've had lifelong friends similar to Sandra and her girlfriend Irene. And so I was able to open and discuss stuff with my family and friends, and I don't know that I would have been able to do that without palliative care. And to this day, things that have been said to me and provided me by all 3, Dr. Lindenfeld, Greg Merrill, and Sarah, it just resonates and goes forward with me that is phenomenal. And I'm the one that would say as much as I can about it whenever I'm on a Zoom call on Mondays or my monthly Zoom calls on lung transplant meeting that we have. And so I just couldn't say enough about palliative care, and I'm glad to be here and the opportunity to share.
Yes. Sandra, would you like to answer as well?
The only thing I do want to add to that is it's so important when you do go to your appointments, whatnot, because there's so much information that you're getting. It's nice to have another set of ears and eyes. We always usually had 4 sets. Always. And to tell anyone, even if they can't be there physically, get on the phone. We always had one of the kids, if they couldn't be there, we would, as soon as the doctor came in, we would get Stephanie or Matthew on, so they were still part of it. Because there's things that you missed, and they're important. And our daughter's a very good note taker, so she would always write it up. And then she's a social worker. Yeah. Yeah, Stephanie. So anyway, I'd like to tell people that. And it's funny, I just got a call from, Michael was talking about Kent, who just had a transplant 2 weeks ago, a double transplant that we've met. We've met so many, our whole new family. And so Sandy, her name's Sandy as well, she just called me. They got discharged yesterday. So she's at the Sonesta where we stayed. And they're in the same exact room that we were in. You know, it's just so, you know, we keep in touch. We share our number with everyone that we can, that we come across. So, like I said, just important to tell people, bring, you know, other people with you when you go for your appointments. So you know, gather all the information that you need.
Michael, I first want to say congratulations that you got this transplant. That's really amazing, and it means that we get to meet you today. You spoke a little bit about that sort of a unique experience for patients who are facing a serious illness, who are even, their disease is such that they can even consider a transplant, right? And that I think of folks in that situation, sort of on the cusp of a transplant, in a unique situation that you're simultaneously hoping and preparing for a transplant, but as you said, it's a precarious place of maybe you will, maybe you won't, so you're simultaneously preparing if you don't, and it's out of your control. So I wondered, that's the context you're in, but I'm curious, well, my real question is when palliative care was introduced to you, because you're sitting in that place of which way should I be thinking, what was it like when it was brought up? When somebody said, I think we want to introduce palliative care, how was it introduced? How did you receive it? I can see how much you enjoyed it and benefited and just can't stop talking about it. But I'm curious, when it was introduced to you, what was that like?
Oh, well, so our daughter Stephanie found out about it and got us rolling, you know, got it all set up. And yeah, she did. And I'll tell you, that's the scary part. When you're first diagnosed, you don't know. You don't know where to turn to. You're given this, he was given this diagnosis, but I kind of feel like it's, you know, the two of us. And you don't know what to do. You're just kind of out there. And luckily, our daughter, the social worker, she just started researching, finding out stuff. And so, yeah, you just have to be an advocate. And hopefully, anyone else going through this will have family or friends that will help you get through it and find out what you need to find out.
And I guess to add on to that, you know, my family took care of me and led me to Greg, and then Dr. Lindenfeld, and so on and so forth. And I would just say that I couldn't have answered that question. She had to answer it because I really didn't know at the time. Yeah. And so the minute I met Greg, it was like heaven sent. You know, Greg and I just, well, maybe it's not me for sure, but Greg made it so easy, comfortable, and maybe my personality is I'm open to a lot of things and willing to listen and willing to do stuff. And God knows, I told him I was a bulldog, and I am stubborn. There's no doubt about that. But in many aspects, I am open to what was presented, and I ran with it without question. And but he knows I'm a bulldog. But being a bulldog kind of got me to the finish line, and so I'll accept that. I have a bulldog, and she's wonderful.
We have I think Andrea has a question, but I just want to say we identified your two core strengths as persistence and your growth mindset. And those things served you very well.
And speaking of Stephanie, we have Stephanie here. She wanted to say the palliative team held our family and helped us and my dad live our lives and be present during the most challenging and unknown times, and continued to do so. Before we wrap up, I also wanted to share when I spoke with Michael about a month ago, to discuss coming here today, that we had a lovely chat, and at the end of it, I was already, thinking about like work and everything, and he's like, okay, I'm gonna, I have to get out. I have to go out and do my 3 miles today. And I was like, oh my gosh, you are my motivation. Okay, I'm gonna go out and do 3 miles because you're doing 3 miles. So everyone, get out and get your steps in.
Thank you so much for being with us today.
Wow. Thank you so much. Thank you for being with us. Thank you for being here. Thanks for all your insights and wisdom. And I just want to say, we also think that Greg is heaven sent. So I think we all agree on that one. So thank you. Thank you, Greg.